A client with hypertension is prescribed enalapril, ACE inhibitor. What is the nurse's priority assessment before administering the medication? A. Blood pressure. B. Respiratory rate. C. Serum potassium. D. Urine output. Answer: A. Blood pressure. Rationale: ACE inhibitors are commonly prescribed for hypertension. Before administering, the nurse should assess the client's blood pressure as these medications can cause hypotension. Question: a client is receiving heparin therapy for deep vein thrombosis. What laboratory value should the nurse monitor closely? A. Platelet count. B. Activated partial thromboplastin time, APTT. C. Prothrombin time, PT. D. International Normalized Ratio, INR. Answer B. Activated partial thromboplastin time, APTT. Rationale: heparin affects the intrinsic pathway, and monitoring APTT helps ensure the therapeutic range and prevent bleeding or clotting complications. Question: a client is diagnosed with heart failure. Which assessment finding indicates fluid retention and congestion? A. Increased urine output. B. Decreased jugular vein distension. C. Crackles in the lung bases. D. Hypotension. Answer: C. Crackles in the lung bases. Rationale: crackles in the lung bases suggest pulmonary edema, a manifestation of fluid retention in heart failure. Question: the nurse is caring for a client with chronic obstructive pulmonary disease, COPD. What is the most appropriate nursing intervention to promote oxygenation? A. Encourage deep breathing and coughing exercises. B. Administer oxygen at a high flow rate continuously. C. Restrict fluid intake to minimize respiratory effort. D. Administer bronchodilators only as needed. Answer: A. Encourage deep breathing and coughing exercises. Rationale: deep breathing and coughing exercises help improve lung expansion and prevent atelectasis in clients with COPD. Question: a post-operative client is prescribed morphine for pain management. What is the nurse's priority assessment before administering the medication? A. Respiratory rate. B. Blood pressure. C. Pain level. D. Urinary output. Answer: IA. Respiratory rate. Rationale: opioid medications can cause respiratory depression. Assessing the respiratory rate before administering morphine helps ensure the client's safety. Question: a client is admitted with suspected appendicitis. What is the priority nursing action? A. Administer pain medication. B. Place the client in a supine position. C. Apply a warm compress to the abdomen. D. Prepare the client for surgery. Answer: D. Prepare the client for surgery. Rationale: appendicitis often requires surgical intervention. Priority nursing action is to prepare the client for surgery to prevent complications like rupture. Question: a client with a history of seizures is prescribed phenytoin. What should the nurse include in the client education? A. Take the medication on an empty stomach. B. Discontinue the medication if side effects occur. C. Avoid alcohol consumption. D. Skip a dose if feeling well. Answer: C. Avoid alcohol consumption. Rationale: alcohol can interact with phenytoin, increasing the risk of side effects. Clients on anti-epileptic medications should avoid alcohol. Question: a pregnant client is Rh negative. What is the nurse's priority action during pregnancy? A. Administer ROD immune globulin, RhoGAM, at 28 weeks gestation. B. Monitor for signs of preterm labor. C. Encourage a diet high in iron. D. Administer folic acid supplements. Answer: A. Administer RhoD, immune globulin, RhoGAM, at 28 weeks gestation. Rationale: RhoGAM is given to Rh-negative pregnant clients to prevent Rh incompatibility and protect against hemolytic disease of the newborn. A client is prescribed warfarin, Coumadin, for atrial fibrillation. What laboratory value should the nurse monitor closely? A. Platelet count. B. Activated partial thromboplastin time, APTT. C. Prothrombin time. D. Serum potassium. Answer: inane. C. Prothrombin time. PT. Rationale: warfarin affects the extrinsic pathway of the clotting cascade. Monitoring PT helps assess the drug's anticoagulant effect.
Question. A client is receiving total parenteral nutrition, TPN. What is the nurse's priority action to prevent complications? A. Monitor blood glucose levels. B. Administer TPN at room temperature. C. Change the TPN bag every 72 hours. D. Increase the TPN infusion rate gradually. Answer: A. Monitor blood glucose levels. Rationale: monitoring blood glucose levels is crucial to prevent hyperglycemia in clients receiving TPN, especially those with diabetes or compromised glucose metabolism. Question. A client is admitted with suspected meningitis. What is the nurse's priority action? A. Administer antibiotics as ordered. B. Initiate droplet precautions. C. Obtain a lumbar puncture. D. Administer pain medication. Answer: C. Obtain a lumbar puncture. Rationale: a lumbar puncture is necessary to confirm the diagnosis of meningitis by analyzing cerebrospinal fluid. Prompt diagnosis allows for appropriate treatment. Question. A client with heart failure is prescribed digoxin. What clinical manifestation indicates digoxin toxicity? A. Hypertension. B. Bradycardia. C. Yellow-green halos around lights. D. Increased urinary output. Answer: C. Yellow-green halos around lights. Rationale: visual disturbances, such as yellow-green halos around lights, are indicative of digoxin toxicity. Monitoring for this symptom is crucial. Question. A client is admitted with a suspected myocardial infarction. What is the priority nursing intervention during the acute phase? A. Administer thrombolytic therapy. B. Encourage fluid intake. C. Apply a heating pad to the chest. D. Administer anticoagulants as ordered. Answer: A. Administer thrombolytic therapy. Rationale: thrombolytic therapy is a time-sensitive intervention to dissolve clots in the coronary arteries and restore blood flow during a myocardial infarction. Question. A client with chronic renal failure is prescribed a phosphate binder. What is the nurse's rationale for administering this medication? A. To increase serum calcium levels. B. To decrease serum phosphate levels. C. To improve hemoglobin levels. D. To enhance potassium excretion. B. To decrease serum phosphate levels. Rationale: phosphate binders help control hyperphosphatemia in clients with chronic renal failure by binding to dietary phosphate and preventing absorption. Question. A client is prescribed a fentanyl patch for chronic pain. What is the nurse's priority assessment before applying a new patch? A. Blood pressure. B. Respiratory rate. C. Pain level. D. Temperature. Answer: B. Respiratory rate. Rationale: fentanyl is an opioid analgesic that can cause respiratory depression. Assessing the respiratory rate before applying a new patch helps ensure the client's safety. Question. A client is admitted with an exacerbation of ulcerative colitis. What dietary modifications should the nurse recommend? A. High-fiber diet. B. Low-residue diet. C. High-protein diet. D. Low-fat diet. Answer: B. Low-residue diet. Rationale: A low-residue diet reduces bowel irritation and is commonly recommended during the acute phase of ulcerative colitis. Question. A client is prescribed levothyroxine for hypothyroidism. When is the best time for the client to take the medication? A. With breakfast. B. Before bedtime. C. On an empty stomach in the morning. D. With a high-fiber meal. C. On an empty stomach in the morning. Rationale. Levothyroxine should be taken on an empty stomach in the morning to maximize absorption and prevent interference with other medications or food. Question. 20. Question. A client is diagnosed with bipolar disorder and is prescribed lithium carbonate. What should the nurse monitor closely during lithium therapy? A. Serum potassium levels. B. Blood glucose levels. C. Serum lithium levels. D. Urinary output. Answer. C. Serum lithium levels. Rationale. Lithium has a narrow therapeutic range, and monitoring serum lithium levels is essential to prevent toxicity or subtherapeutic levels. 21. Question. A client with heart failure is prescribed spironolactone. What should the nurse monitor closely to detect a potential adverse effect of this medication? A. Blood pressure. B. Serum potassium levels. C. Heart rate. D. Respiratory rate. Potassium levels. Rationale. Spironolactone is a potassium-sparing diuretic, and monitoring serum potassium levels is essential to prevent hyperkalemia. Question. A client is prescribed prednisone for an acute exacerbation of asthma. What is the nurse's priority teaching about this medication? A. Take the medication on an empty stomach. B. Taper the dose gradually when discontinuing. C. Increase fluid intake to prevent dehydration. D. Administer the medication with antacids. Answer. B. Taper the dose gradually when discontinuing. Rationale. Abrupt discontinuation of corticosteroids can lead to adrenal insufficiency. Gradual tapering is necessary to allow the adrenal glands to resume normal cortisol production. Question. A client is admitted with a hypertensive crisis. What medication is the nurse most likely to administer to achieve rapid blood pressure reduction? A. Lisinopril. B. Amlodipine. C. Nitroglycerin. D. Sodium nitroprusside. Answer. D. Sodium nitroprusside. Rationale. Sodium nitroprusside is a potent vasodilator used for rapid blood pressure reduction in hypertensive emergencies. Question. A client with a history of chronic alcohol abuse is admitted with hepatic encephalopathy. What dietary restriction should the nurse implement? A. Low-protein diet. B. Low-fat diet. C. Low-carbohydrate diet. D. Low-sodium diet. Answer. A. Low-protein diet. Rationale. A low-protein diet helps reduce ammonia production, which can exacerbate hepatic encephalopathy in clients with liver dysfunction. Question. A client is prescribed isoniazid for the treatment of tuberculosis. What assessment finding requires immediate intervention? A. Decreased appetite. B. Yellowing of the skin and eyes. C. Tingling and numbness in the extremities. D. Photosensitivity. Answer. C. Tingling and numbness in the extremities. Rationale. Peripheral neuropathy is a potential side effect of isoniazid. The client should be assessed for symptoms such as tingling and numbness, and pyridoxine, vitamin B6, may be recommended. Question. A client is prescribed warfarin and asks about dietary restrictions. What teaching should the nurse provide regarding vitamin K-rich foods? A. Increase intake of vitamin K-rich foods. B. Avoid vitamin K-rich foods. C. Maintain a consistent intake of vitamin K. D. Consume vitamin K only in the evening. Answer. C. Maintain a consistent intake of vitamin K. Rationale. Consistent vitamin K intake helps maintain stable anticoagulation levels. Clients on warfarin should not drastically increase or decrease vitamin K consumption. Question. A client is admitted with suspected acute pancreatitis. What is the priority nursing intervention? A. Administering analgesics for pain relief. B. Encouraging a low-fat diet. C. Monitoring blood glucose levels. D. Maintaining nothing by mouth, NPO, status. D. Maintaining nothing by mouth, NPO, status. Rationale: keeping the client NPO helps rest the pancreas and reduce pancreatic enzyme secretion, promoting healing in acute pancreatitis. A client is receiving heparin therapy and reports sudden onset of back pain. What action should the nurse take? A. Administer pain medication as ordered. B. Assess for bleeding and check the hemoglobin level. C. Apply heat to the affected area. D. Encourage increased fluid intake. B. Assess for bleeding and check the hemoglobin level. Rationale: sudden back pain may indicate retroperitoneal bleeding, a serious complication of heparin therapy. Assessing for bleeding is a priority. Question: a client is diagnosed with major depressive disorder and is prescribed fluoxetine. When should the nurse inform the client that therapeutic effects may become noticeable? A. Within a few hours of the first dose. B. After 1 to 2 weeks of consistent use. C. After 4 to 6 weeks of treatment. D. Only after the medication is discontinued. Answer: C. After 4 to 6 weeks of treatment. Rationale: fluoxetine and other selective serotonin reuptake inhibitors, SSRIs, may take several weeks to achieve therapeutic effects. Clients should be informed about the delayed onset of action.